and now we are. TDOV is dedicated to celebrating the accomplishments and victories of transgender and gender variant people, while simultaneously raising awareness of the work that is still needed to combat discrimination and violence. This is so important to me as a non-binary person, as well as an everyday human and a passionate teammate at Included Health. We have made a lot of progress, it's true, but we still have a long way to go in terms of achieving a truly inclusive world. And with that, I'll kick it over to my positively dynamic teammate and co-moderator, Dennis, to introduce themselves.
Thanks, Cass. Hi, everyone. Thank you so much for coming to our event. We're so excited to be doing this for you. My name, as Cass mentioned, is Dennis. My pronouns are they, them, theirs. And I too identify as non-binary, leaning more towards femme, but non-binary. And let's see, you might know me from the podcast I host called Food for Thought. I'm also a writer outside of Included Health. And at Included Health, I'm a care coordinator. And what that means is that I'm one of the people that you might end up working with if your employer ends up partnering with Included Health and you are reaching out to seek support either in finding a provider, navigating your benefits, coming out at work, all of these different things that we handle. I might be the person that is helping you to navigate all of that. There's a whole team of us at Included Health. We're all really excited and energized about this work. And so I just invite you to reach out if you end up working with us. We are hosting this event because we want to bring attention to things that are incredibly important at Included Health, trans advocacy in the workplace and in healthcare. There's a lot of intricacies to this topic, and we really want to talk a lot about that, how people are doing this successfully already, as well as how we can continue and further that progress. We received a ton of questions from all of you, which was so exciting to us. And because we have a limited amount of time, we're going to be addressing the most common themes that we found in those questions. We probably won't have time for a live Q&A at the end of the session, but we don't want to leave anyone hanging. So just like stay tuned, because afterward we will be sending out an email with resources and further information. And with that being said, I am now going to hand it over to Included Health's fearless leader, Colin Quinn.
Hey, good afternoon, everyone. Thank you, Dennis. Thank you, Cass. I'm so incredibly excited to be here, and it's a huge honor to have Included Health hosting and sponsoring this very important conversation in this panel. As Dennis mentioned, my name is Colin Quinn. I use he, him pronouns. I'm based here in Manhattan, New York, and I founded Included Health back in 2019 with the idea to create a better healthcare experience for members of our LGBTQ+ community. We were very intentional about the name because whether as myself experiencing healthcare discrimination and struggles, friends, colleagues, hearing stories from HR benefits leaders, and just really recognizing that the healthcare system oftentimes wasn't made with us in mind. And we really needed to self-advocate and push the needle and drive greater inclusion within the healthcare system for us. So that's how we came up with Included Health. And it's near and dear to my heart. It's near and dear to everybody on this team and on this panel today. So we're incredibly excited to be here. I don't want to spend a lot of time because you did not come here to listen to me talk. You came here to listen to our amazing panelists. But if you do have questions about how we support members of the LGBTQ+ community or how we partner with employers and organizations to support their employees and family members as well, we'd be happy to have that conversation. But I don't want to take up any more time from that because we are here to really celebrate and recognize our trans and non-binary communities and really think about how we can push the needle to further support, advocate, and amplify those voices in light of everything that's going on in this crazy, sad, disappointing world that we're going in right now. These topics are incredibly important. So if you're on the phone as an ally, like, yes, absolutely, like so happy to have you here as an ally. We need more allies, right? So next time I would encourage you to bring one or two more of your colleagues or friends in because we need to do everything that we can for our trans community right now. because they are under threat from many state legislatures right now. So with that, I will pass it back over to Cass, our amazing moderators here and this amazing panel, and we'll take it from there. So thank you so much.
Thanks, Colin. All right, y'all. So we're going to have our lovely panelists introduce themselves. And I'd love it if you could start introducing yourself, as well as sharing your definition of the word ally and explaining how you have in the past and are currently bringing those allyship ideals to life. And Marie, we'll go ahead and start with you.
Hi, I'm Marie Fromm. My pronouns are she and her, and I'm a out transgender woman. I think the first part, my definition of an ally is somebody that'll stand up for me when I'm not in the room. And I think that there aren't many trans people, and so we really need allies to help make our, speak for us when we're not present. I think that there are a lot of cases I'll kind of talk through later on here today where I can really discuss that. But I will say that that's really critically important. Allies have been critical for me. In my day job, I'm actually part of Medtronic's global security office. I work in InfoSec, design and implement cryptographic solutions used in our products and our IT systems. And my gay job, I'm a past chair and decade-long steering committee member of Medtronic's LGBTQ employee resource group. And I said I'm trans and queer. I transitioned about a dozen years ago, and working with product engineering teams around the world. And I was Medtronic's first out trans person, so it was pretty big news. And I've had a particular interest in trans health. And over the last decade, I've done a lot of work with Medtronic and some other Twin Cities-based corporations and smaller tech firms as far as helping with trans-inclusive insurance language, and been kind of an informal advisor for trans topics. So I'll turn it back to you. Yeah.
Thank you. Thanks for introducing yourself and those lovely definitions and ideals. Femily, if you're ready, would love for you to introduce yourself as well.
Sure. Hi, friends. I'm Femily. I am Silicon Valley's gender equity advisor. So that means I help tech companies primarily, but also some health companies, improve for women, non-binary folks, and the queer and trans community. I am also founder of Future Thought Leader, which is a 3-month program for feminists and queer and trans folks who want to get a bigger spotlight so they can have a bigger impact and get their ideas out there. In this context, I'm a queer cis femme and a wannabe would-be ally of the trans community, because my definition of allyship is that I don't get to decide if I'm an ally to a community. They have to decide. You have to decide. It's on your standards and on if you, the trans community, feel that I am standing up for you and really moving the needle. So it's no longer, we have seen white people learn over the past year about anti-racism I'm not gonna say it's no longer, it's never been that you can just be well-meaning, but now more white people know that you can't just be well-meaning, that you have to like move the dial on things that make the world better on an everyday basis for the affected communities. I also wanted to say, and this is something that I talk to tech companies about when I speak about allyship, is that most of us have identities where we need allies. And we also have some identities, most of us, where we have the power and or privilege to be allies. And so, for example, as I spoke before, so me as a white person, I try to be an ally to the Black community, to the AAPI community, and elevate racially marginalized voices through, for example, scholarships in my programs. I do racial justice initiatives with my synagogue. Speaking of which, as a Jewish person in America, I need allies. That's a place where I need allies. I need Christians and non-religious allies to, for example, check the Jewish calendar before putting a major event on Rosh Hashanah, right? Which means I could never attend. As a queer person, I need straight allies who are I love what you said, Marie, speak up for me when I'm not in the room. That's wonderful. And so as a cis person, I have been working to be an ally to the trans community for a while. I worked in college 25 years ago. I worked on an LBGT hotline that was a little bit more focused on LBG, as sometimes things were. So I worked with a trans person to move trans voices to the fore in that training, for example. And now I help companies with their trans affirmative inclusion efforts. So that's me. Hello, and I'm so excited to be here today.
Thank you. That was wonderful. Dr. Green, I'd love for you to go next here.
Thanks, Cass. So I'm Dr. Jamison Green. I am an author and an activist and a former publications manager, engineering group manager in numerous companies. I transitioned from female to male in 1988 as an engineering group manager at Sun Microsystems. And I noticed right away that I couldn't access my health insurance anymore because there was an exclusion in that policy that said nothing will be provided for anything having to do with a trans person. It didn't say those exact words, but it was such a broadly written exclusion that I realized that any motivated provider could use that exclusion as a way to deny me any health care at all simply because I'm trans. And so I saw that as a little problem. And I'd been led to believe that insurance would never pay for trans-related health care. And I saw that as a little problem. And so I set about to change that paradigm there, which I was pretty successful in doing in many respects. But I also got involved because realizing that once we opened up health insurance access, that there weren't enough doctors to treat the trans people who existed already, and that we needed more doctors. And so I started getting involved with an organization called the Harry Benjamin International Gender Dysphoria Association, which later became the World Professional Association for Transgender Health. And because I wanted that's where the doctors who were studying transness and who were writing the standards of care were hanging out, was in that organization. And I thought, well, if I get involved with them, then I can influence what they're doing so that they can be better allies to the community, which was literally barely existent at that point in the early 90s. So it's been a long haul. I ultimately was elected to the board of the Harry Benjamin International Gender Dysphoria Association. And then we changed the name to the World Professional Association for Transgender Health, focused on health rather than on a disease condition. I thought that was a good move. And then I was reelected to a second term on the board, and then I was elected president. And altogether, I spent 15 years on the board serving as a volunteer in changing their policies, getting education for physicians started. And at the same time, I was doing tons of insurance activism with corporations across the range of the Fortune 500 and also smaller corporations, trying to get people to speak up to their brokers and say, no, we want a trans inclusive policy. No, we won't accept this exclusion if we're paying for this care, and we want to support our trans employees, even if we don't have trans employees. So that's been a bit of my involvement. I'm the author of a book called Becoming a Visible Man, newly released in a revised second edition from Vanderbilt University Press. And I'm really happy to be part of this. And I think I said a little bit about what I think allies are, but I'll just, if I can amplify for just a moment, I think an ally is somebody who you can work shoulder to shoulder with, who has your back, who understands what your goals are and supports them, and is willing to speak up when they have an opportunity to do so in support of those goals. So, and I agree with everything everybody else has already said.
Wonderful. Dr. Ng, would you like to introduce yourself now?
Sure.
Hi, everyone. I'm really excited to be here. And I'm Henry Ng. I'm a physician and here at the Cleveland Clinic in Cleveland, Ohio. And I am trained in both internal medicine and pediatrics. And I became involved in queer health and trans care, after my residency, when I realized that there really was a big gap and empty space for a lot of trans folks to get the care that they really need. Folks aren't routinely, at least at that point, we're not routinely provided the opportunities for education in their training, unlike today. So when we talk about being an ally, part of being an ally, and I identify as a non-binary person, I use both he and they as my pronouns. I think that being an ally, this kind of goes back to, I love to kind of geek out and nerd out. So I'm going to go back to my roots of medicine as I'm trained in using my Latin. And of course, this is also stolen from dictionary.com, but allegare, and looking at the Latin term for ally, and it kind of talks about, the ties that bind, the connections that we have. And I think that that's really important. Like when you think about the ties that bind us as strangers and people who know each other are still ties that bind, even though we have different types of relationships or relationships that have yet to become. To be present for somebody else, to bear witness for good and for not good, to intervene, to say something, to do something. I think those are all ways that we demonstrate how we can be an ally. I see that there are a couple of fans of Latin out there, so awesome, thank you so much. I think like for another thing to do that I can try to do as an academic health professional, and now the incoming director of I can actually share that now. I'm the incoming director of the Transgender Surgery and Medicine program here at the Cleveland Clinic, and I'm really happy to be able to provide the support and hopefully leadership and direction to help grow our services to care for trans and non-binary people throughout Northeast Ohio, and frankly, anyone from anywhere who's coming to seek care from us. But part of my job too is not only just like programmatic stuff and developing care and supporting our care team members or caregivers or nurse practitioners or physicians or physician assistants and folks and our students, but we train. We are here to train more and create more. We need more people who have both the clinical skills as well as the cultural sensitivity, nimbleness, awareness of how to work with populations of folks that they simply didn't have experience working with in their home environments or where they grew up or how they were raised. The world is big, the world is diverse, and we are connected very easily now. In the future with travel, once the pandemic is hopefully under better control with more shots in arms, we will be able to connect with people in diverse ways again, and we need to be there for each other. So I was really thrilled this morning to say that I was able to do a little bit of education training for endocrinology fellows at the Cleveland Clinic and talk about trans health, for example, as part of their dedicated education and training. So in my mind, allyship is in all directions and in all ways. It can be in direct ways of being there and intervening when we need to, but also it's creating the people, the infrastructure, the workforce, the environment so that we can do all the right things. So I'm really happy that you allowed me to be part of this. I'm so excited. Thanks so much.
Thank you all for those fantastic introductions. So kind of staying on theme here, or sort of like one of the threads that we're really focused on for this event is allyship generally, whether it's in healthcare, in the workplace, or in public. And so I want to turn over to Marie, and I want to ask you this. Beyond the workplace and healthcare, what are some everyday tips that you have for folks who want to be intentional about becoming better allies to the trans and non-binary community?
Sure. Well, beyond workplace and healthcare, I would say learn from and listen to trans people and seek out trans voices and their stories. Especially look out for some of the trans voices that are not heard as much, including trans men and non-binary people. And I think back, a decade ago, a lot of times if I was on a trans panel, there might be one other trans woman, and that's the only version of trans anybody ever saw. So seek out diverse voices, and I'm so excited about this panel and its composition here today. But I would say some other ways is look at ways you can support trans organizations and nonprofits in your own local communities or state or nationally. And I think here are some good examples in Minnesota. Here we've got the Trans Health Coalition with support groups, shot clinics for hormone injection for people that have difficulty injecting themselves, HIV and Hep C testing. We've got an organization for trans youth, a nonprofit. I think it's some of that ground really, I thought it was really good research that, Rainbow Health did. They're now part of Justice Health, where they did a survey of LGBTQ people in Minnesota and found half of Minnesota trans people did not have a safe place to exercise in. And so they weren't exercising, which has health disparities and impacts. And a quarter of Minnesota trans people at that time had experienced a medical provider using harsh or abusive language. So, I could kind of go on and on. There's, gender justice. It had a local equity win for trans equality in a school. And I'd say a little bit of financial support for some of these 501c3s, maybe in your local state or city, would go a long ways. And I think it was brought up earlier, pay attention to the legislation. I think looking at the bills restricting the rights of trans people or even criminalizing our healthcare right now. 80 plus trans bills have been introduced in this legislative session. And I know a personal frustration of mine is that I don't think a lot of cisgender people or people whose gender is aligned, their internal gender is aligned at birth, I don't think they're aware of the extent of this and how harmful it is for trans people. And so those are maybe some ways that you could be a better ally outside workplace and healthcare. So.
Thank you for that. That's so important, especially the legislation that is happening right now, which we're all sort of reeling from and thinking through. Shout out to Dr. Ng, who's going to be getting my next question. I am a fellow Midwesterner, and I grew up in Cleveland, which I don't think I got to mention on our session. But yeah, I grew up straight from Cleveland Clinic in Cleveland Heights. So I love the Midwest representation. I want to ask you, what advice do you have for people who want to be good allies, but are fearful of messing up, things like saying the wrong thing or being rude? People can be curious, or can people be curious rather, and who do they turn to if they want to ask questions to learn about trans and non-binary folks? And I just want to say, this is a question that we got over and over in the submission. A lot of people have these questions.
Absolutely. I think that, there can be a bit of fear that can be paralyzing for people who want to do good and they want to, be present, be that ally, but at the same time, they're worried that, gosh, I'll just really screw this up big time. And it's true, we can. Even with the best intentions, we can make assumptions that are unbeknownst to us, not helpful or less helpful for clinical and other situations. And this happens to all of us, regardless of when we do our work and how we train. Many years ago, not many years ago, some years ago, I was not too fresh from doing this work, but I thought, oh, I know how to do this. I've worked with a whole bunch of diverse people. I've read lots of books. I've met lots of people. I've gone to conferences. I should know this. And I remember I met a patient who was in their 60s, and I got to introduce myself and said, "Hi, I'm Dr. Ring. It's nice to see you." I call the patient by their given name. And the first thing that came out of their mouth is, "Hi, I'm here to, explore gender care, and I want to transition," and blah, blah, blah. And I just realized in that moment, gosh, I just really screwed this up myself. So I think part of it is like having some humility and realizing that there are steps and ways that we can less often step into things. We will. And when we do, I think the issue is to recover quickly and say, gosh, I really didn't mean to be disrespectful or to use a name that you don't go by or to use the pronoun that you don't use. I'll make sure I'll make a note and I'll do that moving forward. Not make a big deal of things, but acknowledge the error or the problem that occurred and then move on. It's respectful. And we want to practice respectful inquiry. So we want to ask questions of people that are germane and meaningful, and explain the rationale at times why we may be asking certain types of questions, especially as a healthcare professional. Otherwise, some questions may sound very, invasive or in fact prurient. Why do you need to know about that? I came in for a cold, or I came in for my knee. Do you really need to ask me about this, that, or the other thing? So I think that's really, really important. But yeah, I can't coin respectful inquiry for those of you who like it. I have borrowed that from actually our Case Western Reserve University School of Medicine's curriculum, but I do embrace it. I think it's something that we need to do all the time, and especially for groups of folks who historically have not felt awesome about the kind of care that they received through micro and macroaggressions. We need to fix that. So I think that first of it is the mindset. And for the work that I do when I meet patients now, I often say, hey, hi, it's nice to meet you. I'm Dr. Ring. It's a pleasure. I'm so glad that you came in today. I go by he and they. How can I help you today? Or I see that you came in for such and such because that's what was passed on to me. Let's talk about that. And then we can begin a conversation. For the patients that are I don't take care of exclusively trans and non-binary people. I have a mixed crowd, but about 60% of my patients I see identify as LGBTQ. So, and when people come in, I don't know how they identify. So I just throw it out there. If the patients that I work with, and we've trained our colleagues and trainees to do this, if gender identity and expression is important to them, we've created space for them to share with us. And if it's not an important thing for them to share with us that day or not at all, that's okay too. They can take that door and walk past it, or they can walk through the door. But our job is to make sure that we create space and hold space for people and their identities and experiences.
That's awesome. And also, I too, like many people in the chat, have fallen for the term respectful inquiry, and I'm like, oh, we need to make that a thing. But I think that's so true. Creating the door, and people can just walk through it or not. Mm-hmm. Dr. Green, on to you. As a trans advocate, I'm wondering, what is the number one thing that you would want an ally to do for you in situations where you felt mistreated or uncomfortable? Oh, I think you're muted.
Yeah, you're right. Sorry. Number one, I would like them to encourage me to express myself in that moment. Number two, I would like them to speak up and say, that was a really awful thing that happened. That's unforgivable, or whatever the situation calls for. But I think yes, we need allies, but if I'm present, I don't want to be stepped on by my ally either. And there are times when it's easy to make a mistake. And actually, I had my wife almost do something once where somebody said something that was offensive, but I knew it wasn't the right moment to intervene. And so, but she got all bristly, but she noticed that I was not responding. So she waited. And then later she said, it really made me upset when so-and-so said that. And I said, well, yeah. And it was an unconscious thing. I know this person didn't mean to be horribly rude. And given the context, I'm going to need to have a separate private conversation with them in order to straighten that out. And I will do that. So thank you for giving me the space to do that. Yeah, that's one example. I mean, allies are crucial for our advancement, because often where allies come in is when we're not around. It's when they have access because of their privilege to something that we don't. And they can do something, make an opening. But for them to jump in and be the savior of all trans people, and I've known a few people who have tried to do that, trans people can't speak for themselves. I'll do it. Excuse me, no, trans people are perfectly capable of speaking for themselves. And sometimes they need to give a little push or they need to have that door open so that they can walk through, or they need to have the way paved for them. Somebody needs to say, okay, look, you're trying to put forward this horrible legislation. You've never talked to a trans person. Can I bring a trans person into your office to talk with you?
Absolutely. Absolutely. I think that's such an important point as well. The idea that like trans people have voices as well and want to speak up. And Femily, I'm turning to you. I'm just wondering if you can share some suggestions for handling circumstances where a customer or a client is rude to a trans or a non-binary person. I personally have a lot of years of experience in retail from the first few years of my career. And in retail, of course, the saying is the customer is always right. But we know that in fact, that's not the case all the time. And so I'm just wondering if you have thoughts on that.
Yeah, totally. From the ally perspective. Yeah, so the good news is most companies already know what they would do if someone came in and was a client or customer came in and was rude to someone because they were Black or because they were a woman. There are policies and people know how they're supposed to act. So we don't have to make this as though it's a whole thing we can't learn because we don't know that much about transgender people or the transgender community. There are ways in which a lot of this is translatable. So and we've learned, lots of us have learned, especially over the past year and especially recently with the AAPI, anti-AAPI violence, a lot about bystander stuff. So as a quick refresher, doing nothing is not really acceptable. It condones it unless you're very attuned to the person, like Jamison's wife, right? And that's first and foremost, trying to ESP what the transgender person wants, right? Otherwise, doing nothing is not okay. Intervening early and often before it gets escalated. You don't have to have a PhD level thesis on what the person did that was wrong. You can just say something. If you know the person, you can say their name. Often you can say Alex, or not cool man if you don't know the person's name, or not cool pal if you don't want to be all gendery. You can say, okay, we're out of here, and take the offender. People work in all different kinds of environments, but if it's an office environment and the person's not drunk and angry, then you can usually be like, okay, we're out of here, right? Or let's not do this. The important thing is finding a phrase that doesn't escalate, but that makes it clear you're not here for that. If you're in a sort of public and you're at a ball game, I'm never even going to a ball game, but if you are, or you're like on the subway or the public transportation and this thing is someone is picking on someone or doing macroaggressions against someone who is in a lesser power position or whatever, or any person, you can distract the person by saying like, you're a Patriots fan, or can I borrow a phone charger? Just literally anything that gets them a little reacclimated. I mean, these are very broad statements for so many minuscule specific events, but these are the kinds of things. Speaking to the person is really important. The affected party, saying, even just talking to them about the weather, so it's clear to the offender that the offended person has a mate with them, that someone's on their side, that someone's seeing, someone's here. You can say, how can I get you out of this situation? Sorry, those are some motorcycles. You can say, I'm on your side. I'm happy to leave with you right now if you think that would be the best thing. And sometimes the person will take you up on that. The most important thing here is you don't have to be perfect. Mostly these are social interactions, none of which, they're in society among humans, one of whom is acting badly already. Like, the bar for you acting is very low. You just have to do something and be on the side of the person who's being impacted. And then don't, this is like bonus 2.0 version for allyship. Don't expect a reward for having stepped in. Like, you're not a hero. It's your moral responsibility. If you care about humans and equity on the planet, just help the person get on their way into a safe situation and then go back to your day. There we go. I'm Femily and I'm done talking.
That was excellent. Thank you all. So what I heard, of course, as we all just heard, is It's so important when, as an ally, acting up in different spaces that you may find yourself in. It's no longer okay. It never has been. And especially now, it is not okay to do nothing. As Femily mentioned, the bar is low. So speaking up, making sure that you can diffuse the situation, comfort the kind of offended person, those things are incredibly important. We also heard that listening to trans voices, and if they're not already in the room, bringing them into the room is incredibly important. Being, humble, being intentional, asking meaningful questions, and speaking up. These are some of the wonderful things that the panelists just shared with us. And with that, we'll jump into the next topic here. We're getting into how employers can provide environments that are inclusive for folks of all genders and all backgrounds. So we're actually going to swing it back around to Femily and ask, what are some basic first steps for an employer to take in creating an inclusive environment for trans and gender variant folks?
Yeah, so first thing is to know that it's not that great out there for trans and gender non-variant folks in the workplace. Just because you have one colleague who is gay and white and out and proud and one part of the LGBTQAI umbrella doesn't mean that it's great for your trans folks, your gender non-conforming folks, and your intersex folks in your workplace. 47% of trans folks have experienced discriminatory behavior and just stupid, demeaning jokes and comments on a daily basis in their workplaces. So that may be a surprise to those of you who are cis who are on this call. But so the first step is understanding it ain't that great out there, and there's a role you can play. So I'll pop a checklist in the chat so that you can have some 10 steps to do at your workplace to see if you're doing them already. But the things include all the things that you'd be doing for the queer end of your LGBTQAI spectrum. Do all of those things. Trans people need all of those things in the workplace, as well as some obvious ones you would see if you Googled it, like trans relevant healthcare, the flexible HR system that allows folks to either opt out of identifying as a gender or put the X, the flexible HR system that allows someone to go in there and change their name like people can do when they get married and get a new last name, signatures and Zooms and HR information systems that allow people to select their pronouns, and also hide previous gender markers or previous names, that having it that behind a wall if that is part of a transgender person's experience, is that they're not bringing that out in the workplace. So obviously no genderized dress codes, right? Obviously having gender neutral bathrooms. Here are some not so obvious ones. Having a clear policy and a good roadmap of what to do when the following things happen. When you want to transition at your company, right? You should be able to click, you should be able to know, oh, there's a roadmap for this. Click in a thing, and then it tells you, here is the roadmap we suggest. We suggest you talk to this person in HR who knows all the things. We suggest, here's a template for how you might inform your team. Like, you're already thinking about the transition. Like, you shouldn't have to craft the perfect email. Like, here's a template, you should make it, right? These roadmaps for if you want to start sharing that you are non-binary or use different pronouns or use a different name, like a roadmap for that also, not just like the transgender experience, but also the non-binary experience. Also a roadmap for the people in HR, people who are managers, and people who are colleagues whose teammate has said to them, I'm non-binary, I'm trans, etc. So that they can know what the roadmap is, and they can know some common kind and cool ways to treat the person, and some common uncool, unkind ways that are pretty popular. And you don't have to train, this is a little countercultural, and so we might get some disagreement here, but you don't have to train every single person in your organization how to be a PhD level ally to the trans and non-binary communities. You do have to train them that everyone is welcome here, especially trans and non-binary people, and we have roadmaps, and you are expected to follow it and be kind and cool and inclusive, and here's where they are. That's the part everyone needs to know, not the 1000% ins and outs. And that's an easier sell to your execs also. I'm done.
Nice, thank you. We're gonna shift over to Dr. Green next here. How can employers ensure that they are welcoming trans and non-binary or gender variant employees, providing ongoing training and facilitating that everyone is able to be their authentic selves at work?
Well, I think it needs to be a clear policy. It needs to be in the code of conduct. If your company has a code of conduct, it needs to be in any kind of HR resource that this is just included. It's routine for everybody. It's not just the LGBTQI plus people that you're speaking to. You're speaking to all employees on this. All employees need to understand that all of this diversity is part of the milieu. It is the environment that we live in. And what we expect at the company is to be a good employee. In other words, we hired you to do this job and be a team player in that respect. And, we don't demand a lot of other stuff from you, but we make all these other opportunities available to you should you want to avail yourself of them. And training programs, employee resource groups or business resource groups. If you have company-wide meetings, and if they include entertainment at all, make sure there's some kind of a queer twist on it sometimes, and see what happens. That, if you get feedback from that, then you realize you have to deal with some culture problems. It's just an interesting kind of way of assessing what is the temperature here in the culture of this organization. You might be surprised how amenable people are to things if they feel like they don't have to defend something that they think they have to defend because they're afraid of people judging them. So it's an interesting thing that I think diversity officers and corporate leaders in general need to make sure that these qualities, these values are being supported and are being emphasized as part of how we do business.
Very well said. Thank you. Marie, going beyond inclusive bathrooms and guides like name and pronoun changes and how to talk to your manager, what are the less obvious but very important steps that employers can take to welcome trans and gender variant employees?
Well, I'd say things like, the education that was talked about previously, at least making it optional. So more people, I guess, have some transcultural competency. And I think back 12 years ago when I transitioned, it was the dark ages and nobody knew anything, or nobody at my company had ever met a trans person. So more people, there's more awareness of trans people now. So I think, maybe it shifted a little bit because now there's certain people that may have misconceptions about us. And so how can you kind of push, kind of correct some of those misconceptions? And I think, giving tools to coworkers to support a trans employee. And I think, some of the things that my global security office colleagues came up with I was completely unaware of this until a year later. And I found out that they spent a lot of time over a month practicing each other using my name in sentences because they had referred to me by a different name for several years. And, and so that, they took the time to do that. And a couple of my coworkers, colleagues in the security office, they stood up for me when there was some drama about bathrooms. And, somebody was trying to say I shouldn't be allowed to use the bathroom, which is kind of a bizarre thing. But, my colleague turned to him and said, the only thing I care about is when I'm sharing a bathroom with somebody is if they wash their hands. And I've been in the bathroom with Marie and she does, so I'm fine with her. And I thought it was a good way to diffusing some of the nonsense. I'd say other things is putting pronouns on email footers, things like that to help normalize it, by cisgender people who are not trans. And then, I think normalize pronouns and introduction. That can be very helpful. That can be very welcoming for trans people to hear that. Hear an execs get up and say, "Hi, I'm Jerry. My pronouns are he and him." And it's like, those are things that are very helpful. I'd say review of IT systems. My goodness, the challenges I ran into. My initial name change was rejected because it was hard coded that if you changed a first name, it was an error because people only change their last names, right? And so that my name change kept getting kicked out, and it wouldn't replicate to various systems in our company because a first name change is a mistake. It's only last name because people only get married and divorced. So I think really review and testing out some of these IT systems and looking, how do they handle a first name change? And then understanding the challenges some trans people have updating their name and gender. And there are states in the US that make it difficult or impossible to update gender markers on documents. And so look at ways your organization can help trans people navigate and have their chosen name used. And I think that, oftentimes in an organization, it may be very gay and lesbian inclusive, but I think unless you see trans people see specific attempts at trans inclusion, that they don't necessarily assume that's an inclusive environment for them. So those are a couple things right there.
Thank you. That actually is a perfect segue into the final question of this topic for Femily. Can you recommend some ways that companies can attract and recruit trans and gender variant employees, and any websites, resources, tips, and tools that you have to share would be super helpful as well.
Yes. Okay. So the first thing is there was a study recently in California which showed that 27% of youth in California identify as trans or gender nonconforming. So it's not really a question of if you're going to need to be savvy at recruiting the trans community, but rather when. And the when is really now. So I'm glad you're asking this question. Trans folks, there's a hiring bias against trans folks, which means that trans folks are underemployed and overskilled. Trans folks are overskilled, especially in the tech industry. So this is a huge opportunity for tech companies, especially, and for any company that has technical roles, which is basically every company. So the first thing is certainly you can recruit at places like Trans Can Work and in LGBTQ and tech spaces on Slack. At Lesbians Who Tech conference is very trans and non-binary friendly, and they have job boards, etc. But the truth is, if you make your company trans friendly, the underground network of trans folks who are excited about companies that are trans friendly, like the word will really get out. So the focus is not really on glossy campaigns to attract trans folks and non-binary folks, though you should certainly be picturing trans folks, gender variant folks in your marketing. The focus should be on making your company one that has the kinds of healthcare and culture that that trans folks want to work at. And so you'll want to also audit your recruiting documents and intake forms and websites and scripts to make sure they're not gender enforcing, right? And change them if they are. Like, if your CEO's in a video on the website saying,
Oops, Femily, we just lost your audio. I don't know if
ladies and gentlemen of company X, we're so glad to have you here.
Yep, it was coming through slowly. I heard you say that if there's a video on your website, for example, with the CEO addressing ladies and gentlemen, that's a bad start. That's a red flag already. It's a red flag for me. That's well, I guess I'm not welcome here. That's kind of the sign on the door. So I'd love for you to try to finish your thought if we can hear you, if you want to test it out.
Yeah, are we good? Can you hear me?
Now we're good. Yep.
Okay, great. Help your recruiters know which policies to sort of tout when they are talking to someone who cares about, who has mentioned that they care about trans policies, etc. You'll want to have
Emily, I'm so
a
sorry. We're
recruiting
having a terrible
site
time
that
hearing you.
shares policies.
Okay. Well, I know that Femily had a lot of really exciting and important things to share about how you can recruit and attract non-binary, gender variant, and trans employees. This is, of course, what she does full time. So we will make sure to send out information after this. And then with, any of the resources, Femily, that you were mentioning, if you want to throw those into the chat as well for folks to kind of refer to, that would be great.
That is exactly, Cass, what I was just going to say. And just to sort of recap that section really quickly, one of the things I was reminded of is this thing I'm always talking about, the streets always talk. Like if your company is trans friendly, and if you're working on making your company trans friendly, the word will get out, the community will be talking about you, and you will attract those applicants. It's really important to be evaluating the systems in your workplace, including the IT systems, so that they aren't gender specific. It's really important to have and create clear policies that specifically address, name, and include the trans community. Sometimes the needs and the support systems are different than those that are from the sort of the L and the G. And make sure that your HR people and systems are equipped with the roadmaps that are needed to support both trans employees and the larger community, making sure the larger community in their effort to be welcoming to their trans colleagues. So thank you again. We had so many questions about that in what our attendees submitted. So really appreciate that part of the conversation as well. And the final topic for this chat is on healthcare and policy inclusion. And I'm going to turn it back to Dr. Green. And I'm going to ask, can you tell us more about the WPATH standards of care and how those are relevant for employers?
Well, thank you for that. The WPATH standards of care are essentially guidelines that provide a roadmap, if you will, for people for providers, for clinicians to treat trans people, and also for even business owners or employers to review cultural competency around transgender care. If you are providing trans inclusive benefits, most insurance companies are sort of geared up to follow the WPATH standards. Unfortunately, sometimes insurance companies like previous versions of the standards more than the contemporary versions of the standards. And so they kind of hedge on that. And they'll say, oh, yes, we follow the WPATH standards, but we're going to require you to have a letter from a psychiatrist for every health procedure you want. No, that is not part of the standards of care. There's a lot of misunderstanding and weaponization sometimes of the standards, but they are an incredible resource. It's a great document. Right now, the version that's current is version 7. It was released in 2011. It's about 125 pages of really interesting information, some about the global transgender community, some about what is gender in general, but it also goes into each different specialty, medical specialty, and what sort of baseline concerns are for that specialty in treating trans people. So if you're trying to work on having inclusive benefits, don't let your insurance company tell you that they will that they're following the standards of care when your employees will come to you and say, they're not giving me access to the care that I that I and my physician know that I need to have. You know, that means there's some work to be done in there. So the standards are not the barrier that many people have thought they were. They were a barrier many years ago, back in the 80s. They were a sort of checklist that said you have to do this, this, and this, and then you might qualify for what they were then calling surgical sex reassignment. The scope is much broader now. The understanding of non-binary is part of it. The realization that care must be individualized is a very important part of the standards. Informed consent is a very important part of the standards. It's not that doctors are going to dictate to you what you can or can't do. It's just much broader than that now. And currently we're working on Standards of Care version 8, which we're hoping will be released by the end of this year. Version 7 was a major improvement on all previous editions. Version 8 is refining much of the content of version 7, and also is taking advantage of the fact that we now have 10 years of evidence base and published research that supports what the standards are saying. And so the evidence base is documented in the standards. All of the research articles are cited in the standards, and it's much more clear. So that will be, we had, the version 7 had articles cited, but there wasn't a lot of research at that time. So now we have a much greater evidence base. So the standards you can find, I see this in the chat, you can find the standards at wpath.org and look in the menu across the top and find, it'll say standards, say publications or communications or that sort of thing, and it's in there. And it's available in like 15 languages. It's it's a global document. It doesn't speak directly to any healthcare system. It speaks about trans people and trans care.
I am, just as a person who literally uses those standards at least once a week in my job, that's really exciting to hear that there's going to be an updated version. That's just, I saw that question in the chat too, and just really happy to hear that and excited to see what that's going to entail.
There are 125 doctors working on that new document. That's
amazing and really heartening, honestly, to hear, like, just again in this moment, in this sort of moment politically, it's really heartening to hear that. I'm going to turn now to Dr. Ng, and I'm going to ask you, what are some of the most common triggers that trans and non-binary folks experience when accessing healthcare and navigating insurance?
Okay, so we're going to take this big bomb of a question, and I'm going to try to parse it down to two common factors and at least 7 different experiences in the healthcare system. And there are many more. So I'm not going to be able to go through all of this, but I think these will give you a lot of different examples of why things are problematic. So of course, we have the obvious things like gender markers that have to do with our identity on our identification cards and insurance cards and whatnot, and also the name we go by versus our legal name. So we take that with us, however we're identifying, however we present, and we start off at some clinic, at XYZ clinic, and we have a registration process. There are all the factors and interactions that happen at that front desk. In that space, however it's promoted and marketed, is it the inclusive space or is it more of a gendered binary space? You know, we look at some spaces that are dedicated fully for women's health, which is a great and wonderful thing. We're not saying we shouldn't have that, but we also have to think about who is invited into that space and who does not feel invited into that space. And if there's an issue of equity and parity, what should we be doing about that? So say that we actually get to that space and we have our ID card, however it is, we have muddled through whatever interactions, hopefully they were positive, with that person seated at the desk who says, okay, you're gonna see nurse practitioner so-and-so, we're gonna bring you in the back and everything else. So they give you some work to go through, like an intake form. Again, does that form include ways for you to identify different things about yourself, your lived experience, your gender marker, your pronouns, the name you go by, your anatomic inventory, the parts of you that you have, the parts of you that you don't. Those are the things as health professionals we actually really need to know in order to be able to provide useful, thoughtful, helpful care, because it's based on the anatomy that we have in terms of realizing, is this going to be a health problem, or is this something that we should be recommending some screenings or testing to keep that organ healthy, however we feel about it. Having the ability to make space for that. How about you're waiting for your provider to come see you and you're all of a sudden realizing, I gotta pee. Where's the restroom? Is this a single-use unisex restroom? Is this a gendered men's or women's restroom? How inviting and how safe is that location? Now we're thinking about, I've gone to the bathroom, I was single use, I've gone back into my waiting room, I'm sitting there waiting for the provider, I know they're busy, I'm looking at this to see what health information is there. Everything there is about HIV. Well, that's nice. It's important to talk about that health concern. But for trans and non-binary people, there are lots of different other health concerns that are out there. Are the variety and diversity of health concerns in literature present in the space that speak to me as a person who's trans or non-binary, and not just in one particular issue or facet? Do they include images and inclusion of different people in different bodies, different ages, different abilities in that full diversity of the spectrum of identities? Now I've met with a provider, I've had some labs, I had all these other things that are done, I've had my examination, that all went fine and good. I get my lab results back. Well, there's an M and an F next to half of them. Do they identify and go with how identify or not? Well, recognize that references that are used for laboratory testing and a lot of biometrics are standardized based on cisgender norms. And sometimes some of these tests, for example, pulmonary function tests that measure how well we breathe, how well we get air in and out of us, they do not have norms for folks who are trans. A lot of tests do not. So sometimes seeing those markers that are present that have been assigned to us because they're related to the sex marker sex assigned at birth, as opposed to how we identify in our gender, that can make certain people feel a certain kind of way, especially when that hasn't been explained and we're not prepared. Then we'll move to issue number 6, prior authorizations. So I want to get a medication. My provider has said that I should be getting it because it's appropriate care for gender dysphoria, for whatever else. And now it's not going to be covered. Well, is it going to be covered in part because I'm trans or I'm NB or some other thing? Does my health insurance not cover that because they have a carve out for some reason? Now, under Obamacare, that was not supposed to be a thing. And when we had a change in our leader in the White House prior to President Biden, the enforcement of Section 1557 was not very strong. We would not be able to make concerns and complaints about discrimination in healthcare based on some of the prior authorizations and exclusions. Now we can resume that to some degree. But that was a big problem and still continues to be when there is systematic exclusion of some of the important life-saving services for trans and non-binary people, especially around gender affirmation care. And finally, the last thing I'll talk about is related to diagnoses. So, and this is, I'm sure, one of the things that Dr. Green and others with WPATH are working on, is that for a lot of us who work in the field, diagnoses like gender dysphoria still, although it's an improvement, is still problematic. So the idea that I have to have potentially lifelong dysphoria that's clinically impactful in order for me to continue to receive medical, surgical, or other types of supportive therapy for me to live my best life is really rather antithetical to the idea of being an affirmed person altogether. So I think we need to have a diagnosis that maybe lives more aligned with, hey, I'm a trans person or an NB person, and I happen to need hormones, or I happen to need this type of care. Something that aligns more with function as opposed to potentially keeping us in a box or a label. I would love to see that. I know that a lot of my colleagues also would. So I know that those 125 physicians and scientists are working feverishly to have a very thoughtful and, again, respectful process to refine this type of work. But those are just 7 reasons. If you gave me another hour, I'd probably come up with 170 more. But we ain't got time for that today. So we'll leave that to another day.
That was amazing and comprehensive, and there was so much. Oh, Dr. Green, do you want to? Yeah. Unmute.
I just want to jump in on one little quick thing, Henry, though, that was great. I just want to make it clear to people listening, WPATH does not control the diagnosis. We don't get to name it. It doesn't belong to us. It belongs to the American Psychiatric Association. And according to and we have worked very hard with the World Health Organization to remove trans status from a mental health diagnosis and put it into a physical diagnosis called gender incongruence. And that even itself, I have problems with, but it's still another improvement, just like gender dysphoria was an improvement over gender identity disorder. At least actually gender dysphoria does have an escape clause. Gender identity disorder did not.
Right.
That was a horrible
Yes.
diagnosis.
Yes.
And we fought very hard against that within the APA to make that change, which came down in 2013. But the World Health Organization in 2019 released ICD-11, which removes anything trans from any mental health and puts it into special category of sexually related disorders, I think it's called, and pregnancy is part of that too. Pregnancy creates health issues that are temporary, okay, and they're sexually related, regardless of whether you're male or female, because you can be a male identified person who gets pregnant. But anyway, that being said, the United States, I want to make this very clear, the United States has a really hard time adapting global standards. The United States took over 10 years to adopt ICD-10. I think it was like 15 years before they actually took ICD-10 definitions. And even then, the United States modified the ICD-10 definitions. Now they've got ICD-11. If it could be 10 years before we see ICD-11 codes that we can use in the United States, because the United States doesn't think anybody else has anything important to say. So it's a problem. We know this, and we have to deal with the systems that we have. And I think, companies like Included Health working to help navigate these things, working along with WPATH, working along with trans allies within the APA and the American Medical Association and all the other groups, and including in the plastic surgery arena, trying to get people to recognize that a lot of plastic surgery that trans people have is not cosmetic, it is reconstructive. And that qualifies it in a whole different way with respect to insurance coverage. So these are little, almost under the table battles that we have to struggle with, but they are very, very important. And I want people to realize that we've been working on this for many, many years, and we're going to keep working on it until we get it right.
That's amazing. That was amazing and so helpful to understand too. And yeah, just a reminder that all of this is a team effort and takes so much collective action. I want to turn now to Marie and ask you, many insurance providers still have a gap when it comes to covering all parts of transition-related care. Speech therapy is a part of that, facial and body contouring surgery, permanent hair removal. And I'm wondering, how can companies help to alleviate this burden from their trans employees?
Well, I'll say, preface this to say I learned a ton about how to implement and write trans insurance policies in a workshop where I met Dr. Green a decade ago. I still have like an entire binder full of notes that I wrote that day. At that time, most plans categorically excluded us from insurance coverage. And he helped me see some of the things that could be possible. But I think that one key thing is insurance plans have to be reviewed. The actual contract language by people with direct expertise in trans healthcare and insurance coverage. And if you do not have expertise in that, it will not be a trans inclusive healthcare policy. And I think, back, a decade ago, I partnered with our company's benefits team and kind of taught them and our insurers the kind of things we need to have in there. navigating healthcare for trans people is incredibly challenging. And I think of a couple examples. We wrote early on that facial hair removal would be, covered, and our insurer wasn't covering it. And we, working with our benefits team leadership, we brought our insurers in and said, why not? And one of the things that I was doing was able to contact with some of the other trans employees, at my workplace, and get kind of some closed loop feedback, like how are things working for you? And they could actually bring like, okay, here's the claim number that got rejected. They didn't have to out themselves to anybody else. And I could just say, there's a problem with this claim, facial hair removal, and take it to our benefits team and our insurers. And, they initially said that, well, under our policies, it has to be a doctor to do hair removal. And honestly, nobody's going to go to medical school and become a doctor to do electrolysis. So kind of explaining the absurdity of that, and then pointing out, challenge them to find a doctor anywhere in the country that did electrolysis for a living, and they couldn't. And they ended up writing a module to their claim systems to help facilitate that, to be able, that particular claim code did not need to be done by a PhD. So also pharmacy benefits managers, where sometimes medications is kind of outsourced in a way to a PBM, and they're looking at just a prescription without maybe a diagnosis code. And so they see maybe a trans woman and don't know that she's trans, and taking medication at a certain dosage that's different than a cis woman typically might, and it confuses them and they'll reject the prescription. And so working out some of those really rough spots, writing explicit language in of what you want covered. And, again, that kind of closed loop system, there was quite a few trans people that transitioned after me, and I would be able to, get feedback, and they'd say, this is not working, or I'm being denied this, and we could go back and kind of tweak that. So that, that's actually, back when I transitioned, everybody in my company knew who I was, and I left some little search indexes in our intranet so people could easily find me, other trans people. But, as we become a bigger company, it's one of the things I'm really excited about with Included Health is, and getting people with expertise in reviewing insurance contracts and helping out, with this closed loop process, maybe doing surveys of trans people, anonymous surveys, like, how is your medical care going? That is so important, because the trans people face just immense challenges in getting healthcare covered. So I'll stop there.
But that's so helpful and such a great reminder of the progress that's been made, as well as how far we still have to go. I want to turn it back to Dr. Ng and ask you for this final question. How can well-being programs be more inclusive of the trans community?
This is a really great question. And I think it's really timely. And, when we think about how the pandemic, for example, has exacerbated all the challenges and struggles that people have experienced, especially for those who are already maybe in resource limited environments, or be socially isolated from supportive friends and family. And now we have a lot of folks who are completely by themselves. Our sense of wellness, and we all recognize that health is not simply the absence of disease. It's the presence of all the good, positive things. It's the ability to live our best lives, to seek our passions, to feel that we are in meaningful environments, doing something useful, happy, and contributing to our own personal growth and hopefully the society as well. It's all those things. And providing medical care and preventing illness and disease is certainly a piece of that, but much more important are the ways that we can maintain our overall mental and physical and spiritual wellness. I think that as we think about how to make those spaces inclusive, we have to think about the intention of those programs and how they make inclusion occur. Simply calling something LGBTQ or trans and non-binary friendly and putting really awesome glittery stickers and things on that, I love rainbows, I love unicorns, I love sparkles, I love glitter, and I'm going to snatch that lip gloss too from you, Dennis, because I'm loving that as much as everybody else. I have to say that out loud today because I stand that. I'm crazy. I'm absolutely loving it. Although it get all on the inside of my mask, and unfortunately I have to wear that at work. But in any case, our goal is to make sure that we have not just lip service, and that way just create all of this rainbow crepe that we put around things, but we make things meaningful. We make things connected. For example, if we have a company and we know that we will have patients or employees rather who may transition at some point, and we want them to be happy and healthy. Well, some of their post-transition care, is not just all medical. It may be related to, physical therapy or other types of things to improve their overall health. Well, are there spaces for that? If you're telling people to go to the gym, is that space affirming? Is it a safe space for someone to exercise? A lot of the patients we care for who are trans or non-binary, especially those who are seeking gender affirmation surgery, they may experience medical issues or medical overweight or obesity. They have a BMI. Now, don't even get me started on the whole colonial power of BMIs and those bodies and those numbers and how it's exclusive. But we can all agree, at least for some numbers above, say, 35, whatever your composition is, that may be medically too much. And specifically for surgery, that's associated with a less good outcome. So if we want our employees who may be transitioning, who eventually want to be healthy, sometimes helping them become smaller is helpful. And aligning their health and aligning their ability to achieve their life goals, being able to find and create spaces for that, or identify those spaces and connect with local communities, or not sorry, communities, local businesses that actually do those things, I think is really, really important. So sometimes there are programs that run through LGBT centers or trans and NB focused identity groups or affinity groups. I want to give a shout out locally to one of my colleagues, and I think is an upper rising hero, Shiro, to Bella Ursa, who has been recognized by the Human Rights Campaign for her work in creating these types of spaces as an up and coming entrepreneur. So she runs Amplio Fitness here in Rocky River, which is in the greater Cleveland area. And she's worked really hard to create a space that is affirming and inclusive for people of all different backgrounds and bodies and genders and identities and expressions, so that if you're a trans femme person who's recovering from surgery and you need to, feel safe and be able to exercise and get stronger, you can do that there. If you're an NB person who is working on losing weight so you can have top surgery, you can do the same thing there too. So I think that we need to be able to identify and find these spaces and these folks who are in these businesses, nurture them, support them, give them business, connect them, and make sure that they're prioritized as part of our overall kind of strategic plan when it comes to creating both I would say strategic business as well as health associated wellness goals.
Oh, everything you just said. Dr. Ng, I have a very serious follow-up question. Medically speaking, is it possible to clone you?
While it may be medically possible, it may not necessarily be ethical. There are all types of ethical issues related to human cloning. So I'll just leave it at that, okay?
Yes, thank you so much.
But certainly part of my goal has been always to be able to share this type of information and hopefully push the needle a little bit more so that there's greater awareness and more people who are all working together toward bending, the arc of justice.
Beautifully said. I think we heard a few things in this section, one of which being the focus on health, of course, as a holistic topic. It's mental, it's physical, it's spiritual, and we're treating the person. We are looking for care that is individualized and informed. We're looking for systemic inclusion, visibility in resources. We're looking for so much improvement to so many systems, including explicit language and policies to make sure that all gender affirming procedures and all care, generally speaking, are covered and encouraged and supported. So Wow, we learned a lot. I am going to quickly share my screen here with just some final parting thoughts. And let's see if y'all are able to see this. So as we've heard throughout this discussion, and generally if you're kind of alive and awake and in tune with what's happening in the world, there's a lot of bad stuff going on. As you heard from Marie earlier, there's over 80 horrifying anti-trans bills being introduced, many of which are being passed across about 32 states I counted earlier in the United States right now. And these are just some things that you can do to help. As Dennis mentioned earlier, we will follow up with more information in an email. This lovely, amazing event was being recorded for most of it, except for the first couple of minutes. So we will find a way to share that with everyone who registered for this event as well. So just want to say thank you all so much for joining. Thank you to these amazing panelists for all the work that you do every day and for your contributions to this event tonight. It was very insightful, and we hope to see many of you again on future events like this. Thank you. Thank you.
Yes.
All right. We're right on time too. Fabulous job,
right.
everyone. Any final thoughts?
That was fun. Thank you.
Awesome.